Have you had stem cell injections and you're wondering, do I really have to go to physical therapy? That's what we're covering inside this video. Hi everyone, my name is Dr. Chris Garcia. I'm a stem cell recovery expert and I help people just like yourself recover safely, properly, and quickly after stem cell injections. The question we get often is, do I need physical therapy? And the short answer into this question is absolutely. There is no other option. You cannot go without physical therapy after recovery. And let me explain why. A lot of people have tried stem cell injections because of their past. They've had surgeries, they've been frustrated with their care, they've tried everything out there. They might have done cortisone injections, PRP injections, cartilage procedures, all the things that you would think about chronic pain or things that haven't resolved on their own. And besides having a knee replacement or a disc replacement, they're now looking for other alternatives that are holistic and don't rely on medications or more injections or more surgeries. So stem cells are a great avenue to naturally heal with this product, and that's fantastic. But here's the challenge. Surgeries and other procedures, you've been used to therapy or rehab afterwards because it's protocol, right? After surgery, you get physical therapy to help you progress to the next level. Well, that procedure, then we cut open your skin and they work through repairing the tissue, and that tissue is now repairing, and then you have to slowly and gradually build up that tissue and allow it to respond to more stress, right? So you can't just have a back surgery and then go squat or run. You have to allow the tissue to heal, build a little bit more strength, allow the tissue to heal, start jogging, build the tissue a little more heal, and then start running. That makes sense to you. Well, here's the interesting point. When you have stem cell injections, that same repair process is happening to the knee or to the joint. Now that creates inflammation and you have repair, and now if you want to go back to running or back to the gym and squat more, that same process needs to happen. You need to start building strength, build a little bit more flexibility, and then you add a little bit more, and then you start allowing them to go to the gym, and then you do a little bit more, and then you allow the tissue to repair, and then you squat a little bit more, or you start running a little bit more. So there's still a systematic process to fully recover, but for some reason a lot of people think, well, there's no scar and there was no surgery, so therefore I don't have to repair or remodel this the same way I would do. So therefore, why do I need physical therapy? Because I don't have a scar, I didn't have a PRP or cortisone injection. These stem cells should just do the job on their own. And while a portion of that is very true, that they're going to do some magical restoration, the challenge here is that physical therapy is not just here to build up all of your strength, but it's also to tell you when you're allowed to do just a little bit more or you're doing too much. It's a guide that every step that you don't go above and beyond where you're supposed to, or if you're really conservative and you don't want to push too hard, we're here to guide you. And so what we do is we provide what we call bumpers, a natural next level where you're trying to achieve this mark. That's great, you've reached that milestone. Next, let's reach that next milestone. You push too hard, now I will bring you back down. And this allows you to see where you should be and compared to what normal values are, what other people have gone through. And now that's fantastic because it gives you the clarity and the confidence that you're doing this properly. So if you're asking, why do I need physical therapy? I just had stem cells, I didn't have surgery, I didn't have anything else. Well, the reality is because your tissue needs an appropriate amount of stress in a very gradual progress to be able to get you to the point that you want. Now, you had stem cells to get you to the point of being able to play with your kids again, or go to the gym, or play basketball or pickleball. That's what your ultimate destination was. You had this procedure to get you to a point. Now, most people try and do this independently or on their own, and they try to go a little too fast. It's too steep of a curve and too quickly. And so a lot of times we slow people down, not to do less, but to do it appropriately at the time point points that are appropriate because we know when the tissue is ready to heal for that next phase. So physical therapists will point you in the right direction. They'll give you guidance on what to do at the appropriate time, what not to do, and give you that security that you're maximizing all the money and the time and energy that you invested into stem cells. If you want, you consider it like a surgery without the scar is the best way to think about that. So let me put the question back onto you. If you had surgery, would you do physical therapy? Absolutely. So if you've had stem cell therapy, would you do physical therapy? Absolutely. So to answer the question, I've had stem cell injections. Should I or do I really need physical therapy? Absolutely. And it's going to be the best thing for the long term. Maybe you might say, you know, it's inconvenient, it's far from my house, or I really don't have time for that. Now, ultimately, that'll just delay your progress, slow down your progress, or you'll see no progress. And that's not what you want. So if you're looking to maximize your results, physical therapy is for you. So if you need any support from myself or my team, feel free to reach out to the stem cell recovery experts. All our contact information is below. And we're just excited to be able to help you along your journey to better health and while you recover from these stem cell injections. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on recovering safely to create long-lasting results after stem cell therapy. Thanks, and I'll see you soon.